And we are live. Hello, everybody. If you're applying to the Rural Health Transformation Program, you're probably very busy and probably unsure about all the complexities of this program. And today I want to draw attention to an extremely important mission critical area that a lot of organizations who haven't won this type of grant before might need to pay attention to. So I'm going to be sharing 5 procurement must-knows for your implementation of Rural Health Transformation Program. And the important thing about this is to remember that this is a federal grant that is then being awarded to states who are then awarding it to you. So you are what's called a sub-awardee of that federal grant. So there's going to be multiple layers of procurement standards and guidelines you need to adhere to. You've got the CMS federal guidelines, you've got your states guidelines, limits of procurement, for example, and then you've got your own organizations, guidelines, and procedures. It can all get a little bit complicated, and I want to help guide you through that today. So the intended audience for this video is procurement managers who want to quickly kind of refresh themselves on what this program is all about. Also program managers who are planning out what their program will look like and what services they're going to offer to patients or what workforce programs they're going to implement, who just want to understand what are the limits of procurement and who can they contract with before doing a formal procurement, who can't they contract with, and help you understand as you go through planning this. So I'm going to jump into a presentation I have prepared for you all, and we can also jump out of that whenever we want to focus in on me. So as I get that up, please just share in the chat where you're joining from. It's always great to hear where people are watching from and to engage with you all. And if you have any questions at all, you can go ahead and put them in the chat, and me or one of my team will look into answering them. So I want to start by giving you a word of encouragement, saying procurement process for this is laid out. It's laid out in federal guidelines and your state guidelines, and states are here to help you with this. So we've seen that most state Department of Health are opening up a technical assistance team who will help you with your procurement. So don't fear, you're not alone with this. The intention of this video isn't to give you everything you need, because your state is going to be different. Every state is different. The organization's needs are different. Good news is your state should have a group of people that you can then reach out to, go through the Department of Health Rural Health Transformation Program channels for whatever state you're in, and they will be able to tell you more about how things are done in your state. So I want to ask, does anybody know what this is? This is, it's quite a long name, Part 200, the Uniform Administrative Requirements, Cost Principles, and Audit Requirements for Federal Awards. So that's a bit of a mouthful, but essentially RHTP awards are federal grants. So they follow what's called a pass-through model. So state agencies are going to receive federal funds and distribute them to sub-awardees, which is you. Now, because these are federal funds, you must comply with this guidance. So you can just Google the headline title you can see on my screen there, and you'll actually be able to pull it up to fully understand what are the guidelines which need to be followed. And that's great news, because it's all there for you online when it comes to the federal level. As I said, your state and your organization will have different guidelines, and I can jump into that a little bit later, but this kind of overarching rule set is available online. Look it up and you'll be able to explore what I'm going to jump into here. So that's my tip 1. Look up the guidelines that are available online on the federal level. The tip 2 is to be aware of the thresholds. So threshold is up to a certain value, you have to take a certain procurement action. So there's 3 different thresholds that you should be aware of. And the first one is the micro purchase threshold. So what is a micro purchase? Well, if you're going to be contracting out, a piece of work could be a small scale marketing project or a purchase of equipment, and that contract is below $15,000, you don't need to solicit any competitive price or rate quotations. If you consider the price to be reasonable based on research, experience, purchase history, other information. So you're kind of making that assessment yourself, and you need to maintain documentation to support it. So from the wording, there's a few things that are as a caveat to this. The first is that this micro purchase threshold could be increased up to 50,000 if, and I'm quoting here, the recipient or subrecipient may self-certify a threshold up to 50,000 on an annual basis and must maintain documentation to be made available to the federal agency or pass-through entity and auditors. The self-certification must include justification, clear identification of the threshold, and support documentation of any of the following. So A, qualification as low-risk auditee. B, annual internal institutional risk assessment to identify, mitigate, and manage financial risks. Or C, for public institutions, a higher threshold may be consistent with state law. So it's either going to be 15,000 or 50,000. As I said, depends on whatever your state is allowing. But these would be the easiest procurements because you don't really need to get quotes from suppliers, release a RFP, or invite people to bid. You can just make this purchase, demonstrate that you think it's justifiably for 50,000 or less, and always maintain records around that. So at the end, I'm going to show you a plan for maintaining records, but as I go through this, it's crucial in case you do get audited that you have showed your justification behind making each purchase, choosing vendors, contractors, and covered all your bases for if the federal or the state government come and say, we need to see the paper trail. Now, the second threshold, which most people will be interacting with, is between $15,001 and $350,000. And it's called the Simplified Acquisition Threshold for small purchases. So I'm quoting again, if this is used, the recipient must exercise judgment determining what number is adequate. And they haven't specified in the federal level what number of quotes that you need to get if you're between that 15,001 and 350,000. However, the standard is at least 3 competitive quotes. So if you just get one, it's kind of a sole source where you're just going with one organization. And if it's 2, still kind of a coincidence, like unless there's only 1 or 2 organizations that can provide this. So if you are in an extremely remote setting and there's only one construction or engineering firm to do a refurbishment, then there could be justification to sole source it to them. But generally, in most cases, you're going to have to find 3 quotes if your contract is between that 15,001 and 350,000. And I would say, but because this is quite a well-known program, because it's coming out of this administration, which brought us Doge, is trying to find waste, fraud, abuse, or what they would call waste, fraud, and abuse, and root that out and drag it up the ground and say, everyone, look at this waste, fraud, abuse we found. They're going to be on the hunt for weaknesses and gaps, I think. They're going to be on the hunt for people who aren't complying with this. So it's crucial that you align with this. And it can be quite easy to forget, I think, that this standard sits here. So for example, if you have a contractor that you frequently use, you've worked with them for years, you trust them, you say, oh, come work with us on our rural health transformation program opportunity. $16,000 contract, give it to them. That's not the right way to do it. That's not compliant. And even if you get audited, say, in the future, and it's only a little bit above the threshold, or there wouldn't have been any other vendors who were suitable. You have to show that you've at least tried and done the process. So it's critical, as I said, to keep documentation. So who was asked for a quote? How were they asked? Did you send a scope of work, or did you just send them an email asking for prices for their services? And then whenever you choose a vendor, write down why you picked them. So if you didn't pick the lowest price, write down why. Why did you choose whoever got the contract? And another thing to remember for this is it's quite a large band, isn't it? So $335,000 between that 15,000 and 350,000. So you can create a uniform process that's laid out in a standard operating procedure, and everyone involved in your RHTP grant has to follow that if you are bringing in a contractor, and it can be repeatable. So you can have at the start, there's market research. Note down what you did for market research for this contract. Maybe before that, there's scope of work. Write down what the scope of work is and then what market research was done. Then there's the outreach, logging who you reached out to, how you did it, and why you chose those who were picked. A bonus tip here is for SAM.gov verification. So it's really important that you don't choose vendors that are debarred. And that means that they're not allowed to receive money, which is passed through the federal level, and you can't contract with them. So on SAM.gov, you can look up SAM.gov debarred entities and then find out who isn't allowed to receive money, and you'll know that those who you speak with, double check against that list of debarred, and you can affirm that everyone that you're speaking to is actually eligible to receive federal contracting funds. Another piece here is your internal procurement policy. So you have to stick to that as well. If you don't stick with that, you're not being compliant either. So reach out to procurement people or bring someone in from procurement, finance, and ask them. If you're a small organization that doesn't have someone, then if you're the leader, you'll know that you don't have a policy. Maybe it'd be good practice to write down a policy to back up your paper trail on this. And I think for those that are new to this type, they might not have that. So it is important. I think it is useful. You can use AI to come up with things and then verify they're good, and then put that in a folder alongside your process for this, and hey presto, you've got what you need. So we talked about the micro purchase, we talked about the simplified acquisition threshold. Now we're talking about the formal procurement method threshold. So if it's over that $350,000, you will have to do a formal procurement. So that could look like two different activities. The first one is sealed bids. So this is often used for construction projects where you give the contract to the lowest priced qualified bidder. So find the lowest price, make sure that they tick all the boxes, obviously. But once those bids are opened, you can't really go out to negotiate with the bidders. So it's often used when the specifications are 100% clear, and always result in a firm fixed price contract. So this is probably most suitable if you're buying equipment, hardware, you're constructing, and there's not a kind of creative element or bonus points for the approach or technology that they're using. Now the other type is kind of the flip of that, and that's where you put an RFP up. Many of you have been applying to the RFPs related to your state's RHTP, and then you see who bids, and then you can choose who you want. So it doesn't necessarily have to be the lowest bidder, although you're going to want to justify why you choose something that's bid a little bit more. I would say, though, for these, you're going to want to have a clear fixed price contract anyway. I would think if you're getting a set amount from the state, you'll know what that set amount you have is to spend. say it's for support with the retention projects, put a 20,000, or sorry, says $350,001. You're saying that that's the budget that we have for this, and we want you all to bid for that budget. Now, you could accept a lower bidder, and people do that strategically sometimes and come in with a lower bid and then use the money elsewhere. So I would say personally, it's more helpful for bidders, but also for you to make sure that you're spending all the money that you have, that you publicize what your budget is. So you got a problem that you want to solve, and then you care about the quality, experience, and features more than just the bottom dollar. So it's about finding the best value rather than just the best price. So you're going to score the vendors. You need to think about what your scoring system is. You need to negotiate the price if it's not within your budget or you think they've overbid. And this is often used for professional services or software. So those are the 3 levels that you need to bear in mind. So think about what your contracts are. I would say be strategic. Like if a budget line is going to be $375,000, for example, is it worth reducing that budget line and putting it elsewhere so that you can put out a bid for $350,000 and avoid all the procurement doodah when it comes with the formal method? If you want to learn more about this, I would refer you to go back to the federal guidelines, the Uniform Guidance to CFR Part 200. So my next tip is maintaining the documentation. So as I mentioned, that scary word a few times, audit, the auditors might come around and ask states to come into a few programs and check that they've done everything correctly. And remember, it's the Doge administration. They're going to care about people who aren't following process and doing what they would call waste. So there's 5 folders that I recommend you keep on file, and you start putting information into them as you go through procurement for Rural Health Transformation Program projects. So the first one will be planning and specifications. So here you want to put in a memo saying you've researched the price, here's your budget line item for the contract. You want to put in the scope of work for what you're going to be seeking contractors for. And it would also be helpful to put in here your organization's procurement policy. You can do checklists as well that have say we have read the procurement policy, we've created the scope of work, we've done a cost estimate, and include that alongside your memo. Then, when it comes to actually soliciting and releasing an RFP or going out and finding quotes, the good news is for the micro purchase limit and the small purchases up to $350,000, you don't have to do an RFP. So for micro purchases, you can just choose. For small purchases up to $350,000, they just want 3 quotes. So what is a quote? Well, a quote is a vendor telling you their price. So that could be through you reaching out via email and asking them, here's our scope of work, what price would you give us? Or even, here's our price, here's our scope of work and budget, what price would you give us? And they could say, here's our rate per team member, or the rate per the software subscription or seat. Or you can even go on their website. Now, not a lot of service businesses publicize prices on their website, but you can go and look, and if they've listed it there, you can insert it. It doesn't have to be bespoke or custom made for your particular project. So it's not like you need to email them and wait for a quote or do lots of sales calls, which they might want to do to try and get your business. You can say, like, we need the price. And if you already have someone in mind, like, you can just get the price from others and then choose the one that you actually want to work with. So that's how it works. Is it fair? Well, I suppose fairness is you giving equal opportunity to people to win. And if you're giving them the opportunity to sell themselves to you, then that's fair. But it doesn't really have to be fair in that sense. You just need to get your ideal contractor contracted. So it's fine if you already have someone in mind and you just need to box tick, get those 2 other quotes, and then choose the one that you really wanted to work with from the start. As vendors, we don't really like that, but what can we do? So make a list of the vendors that you contacted. I would say beyond just screenshots of quotes, it would be better to send emails and get 5 quotes or so. Not a lot of effort required. Just need to Google, research who provides the services, send them emails, get the quotes, and you've done it. It just covers your back a bit more and establishes a deeper, longer paper trail. Proof of outreach to minority or women-owned businesses. So emails showing that you took steps to promote to include diverse vendors is also encouraged, not absolutely required, but encouraged by the procurement guidelines. Number 3, so evaluation and selection. So keep track of the process of how you're going to be scoring the bids or the vendors, and keep every single response if you're going for that larger $350,000 $1 plus level. Even if it is on the small procurement level, which most of you would probably be within, you want to show your thought process behind why you chose the vendor that you've worked with. So if they've worked with you in the past, that's a good reason to say it. Or that you preferred their team experience and their more experience in your local community. So make a score sheet and show your thought process behind that. And then reach out to your chosen vendor. So if it's someone that you had in mind already, you should send them a separate email, which says more informal language. So congratulations, we have chosen to engage you with this. We would like to enter contract discussions, talk about pricing, rather than just kind of informally in your day-to-day conversation saying, oh yeah, we're choosing you. Don't worry about the other ones that we got quotes from. We just had to do that. Or don't do it over a phone number. Like send an email so you got the paper trail. It's all about the paper trail. Number 4, coming up to the end of this piece, is verification compliance. So screenshot on sam.gov that they're not debarred, and maybe get some documentation to show that they're a US corporation, that services are based in the US, if that's practical. Now, the last piece is the final contract. So if you haven't written one of these before, you might need to get some help from your state, because you want it to be very clear what the scope of work is and how it aligns with RHTP guidelines and requirements from your state. So we know that anyone who's going to get one of these awards will have written a contract before, obviously, but you might need to bring in a little bit of consultation from your state technical assistance body to say, what do we need to put in this to make it absolutely compliant with the program? All this documentation that you're holding on file, you need to archive it and keep it for 3 years after the entire Rural Health Transformation Program closes, which is in 2031. So don't lose this. It's unlikely that they're going to look for it in 2031, but this is something that you need to keep on file in the cloud, print it out, and keep these folders and documentation accessible. So in summary, here are the 3 levels you should think about. There's the, let's just say 15,000. Less than 50,000 is simplified, recommended, or optional. Up to 350,000 required, each of those. And when it comes to over 350, 1,000, you're going to have to do a formal bid process, put it out, open it up for 30 days, let people bid, and then you're going to have to score them. So those levels are going to be more work for you, but those are the rules. So in terms of avoiding traps, just got 3 that you might want to think about to close. So the first one is keeping in mind the regulations through your relationships. We know that business is often very relational, and you might have a vendor that's worked for you for 10 years already. Just giving the money to them because they know how you work is a violation, as I mentioned before. So do the correct process, even if you have someone in mind. And if it's like you've found someone that you think would be helpful for your program, you'll need to say, oh, we find you, let's do this call, they sell you on it, you like it. Then you say, we want to work with you. But before we do, we need to do our procurement process. So you're going to need to go out and find 2 more quotes, for example. And then once you got those, document everything. You can go back to the vendor you find and say, okay, now we're ready to go ahead. Larger health systems are more experienced and adept at supply chain and procurement, obviously. So if you're a smaller critical access hospital, rural health clinic, you may not have procurement staff on hand. So you can either contract with a vendor who will help you with the procurement, engage your state agency heavily to get technical assistance on doing correct procurement, or do it yourself, but pay a lot of close attention to those federal guidelines I shared and the state guidelines, and then your own organization's guidelines. It's probable, no matter how big you are or small you are, you will have guidelines written down there. So stick to them as well. Finally, there's the aggregate spending blind spot, as I would call it. So often facilities think about the individual purchase orders, not the total contract value. So let's say that you want to buy $150,000 of telehealth equipment, then $100,000 of software, then $150,000 of training later in the year. This is all coming from the same vendor. So it's not acceptable to bring in the small purchase limit of up to $350,000 for that telehealth equipment and then do it again for the software and again for the training, because that's all within the same project. And it's gone over the $350,000 threshold. So you need to think ahead really and consider how much money will you be spending throughout the term of your year 1 funding commitment, and bring it in the kind of pots that you would engage a vendor to fulfill for you. So you need to have some foresight, look ahead, and you can't really do these on the fly, because if you end up releasing that first contract, for example, and then you realize you need more, you might have to switch vendor, or even if you do, it might be viewed as this is all the same project and they're trying to get around the guidelines. So before you start things, make that scope of work comprehensive and enough to consume the whole life cycle of the project and related activities. I hope you find this helpful. I hope you like my little mouse with the cheese and the trap, the image. And if you want any more help with planning or implementing your rural health transformation program project, then you can reach out to me. Find me on LinkedIn, Adam Chambers, or reach out to my colleague, Dr. Michael Fitzmaurice, on LinkedIn at the Rural Health Transformation Experts. We're helping our clients and partners 5x the impact of their rural health transformation program projects. How do we do that? Well, often people don't think about the public patient workforce engagement side of these projects. They create the program and then they think people will come if we build it, but that's not the case. You can bring in a lot more revenue, you can cut costs a lot more through the rural health transformation program if you actually get large quantities of people to engage with your programs. And if you don't get them to engage, then you might risk clawback or underspending and care access not improving. So we help our clients go out and find people to come into their programs and actually make them work in terms of participating with them as patients, generating revenue, and applying to them as workforce. So by all means, reach out to me, and I hope that you have a good procurement journey as you go through your program. So thanks for watching, and I will see you on the next webinar. I'll probably do another one next week, and have a good day.